More than 11% of Americans have diabetes. Here in Oklahoma, that number is 14%. However, more than 36% of people have pre-diabetes. And over the past several years, scientists have made some pretty big advances in diabetes treatments. So on this Wellness Wednesday, we're chatting with Cassandra Stanzak, a registered dietitian over at Hillcrest Hospital, to go over some of these new treatments. Cassie, welcome to the 4 o'clock.
Thank you.
Happy to have you.
Thank you.
So let's talk about some of the new medications and treatments that are out there right now.
Right, there's some really good medications out there these days that not only really help the blood sugar control of type 2 diabetes, but also treat and prevent some of the chronic diseases that come along with having type 2 diabetes. So it's changing the way physicians can manage type 2 diabetes and also just help the patient all around in general.
And then, are there different treatments for people with type 1 diabetes versus type 2 diabetes?
There are going to be different treatments. For type 1 diabetes, it's mainly just taking insulin. For type 2 diabetes, there's several different medication regimens you can do. Two of the more newer classes of medication are going to be the medications that you can take that are going to help treat and prevent cardiovascular disease and help delay the onset of chronic kidney disease, which are the two most common chronic diseases coming from diabetes. So when we have these medications that lower blood sugars, boost weight loss, and help prevent those chronic complications, it's a game changer for these patients and really helping them motivate and stay controlled with their diabetes.
Okay, and with knowing kind of the difference between type 1 and type 2, what are some of the common complications that come with diabetes, some side effects too?
Right, so heart disease is going to be the most common chronic diabetes that comes with type 2 diabetes. And so someone who has type 2 diabetes is going to be 3 times more likely to have cardiovascular disease. And every 1 in 3 adults who have type 2 diabetes are going to have chronic kidney disease. Just the longer you have diabetes, the more uncontrolled your blood sugars are, the more common these complications are. So just making sure you work with your physician, with a diabetes educator if possible, making sure that your medications are specific for your problems and your diabetes.
And for people who are pre-diabetic right now, if they want to go in and see a doctor, are there any medications, any treatments they should bring up to maybe get started on?
Mm-hmm. Yeah, with pre-diabetes, it's mostly just, move more, eat less, working to create those healthy habits with diet and exercise, working with a diabetes educator. There's not really medications necessarily that we're going to start with pre-diabetes, but just knowing that we have it, working on it through lifestyle is really going to reduce that risk in jumping over to type 2 diabetes.
And how long have you been with Hillcrest, by the way?
I've been with Hillcrest about 14 years.
14 years, okay.
In the diabetes center that whole time, so.
Okay, and I'm wondering that number just because in terms of people that you see, is it getting worse from your perspective, diabetes in Oklahoma?
No. I think it's all been the same. I think it's being more brought to their attention, and if now is a great time to have diabetes because there's so many new medications, devices, new insulins, everything that's just really helping the healthcare team help the patient and the patient help themselves. So it's just a good time to have diabetes, I guess, if we're going to.
Well, it's good to know that all those resources out there, too,
yes.
And there's people out there that can definitely help with that. Well,
Right.
Cassie, thank you so much.
You're
Happy to have
welcome.
you again.
Yes.